Okay, good morning, good afternoon, or good night. I am Alejandro Villalba Benítez, and I am as a leader of my group, which is formed by Manuel Molina, Javier, Nájera, and David Suarez. Today, we're going to talk about Acarbose and all the things that are important about this drug, such as drug interactions, mechanism of action, indication, and some other stuff that you should really know about this drug. So let's begin. Okay, the first thing we have to know about this drug is what we call the therapeutic class. So what is this? What is this drug? It's an alpha glucosidase inhibitor. So what is it for then? This drug is prescribed, is indicated for people, for patients who need to get better in the matter of their diet and their exercise to treat type 2 diabetes. So we have this in mind, and we already know that we're in front of a drug that is used for treat the glucose levels in blood. Okay, so let's talk about the other things that are important about this drug. Okay, to talk about the mechanism of action of this drug, we first have to discuss and know about the alpha glucosidase enzymes. Where are they? What are they? These are located in the brush border in the intestinal mucosa, and their work is basically metabolize, hydrolyze oligosaccharides, trisaccharides, and disaccharides such as sucrose into smaller monosaccharides such as fructose and guess what? Glucose, and that's what we're pointing at. These enzymes work along with the pancreatic alpha amylase, which is also in the intestinal lumen. Okay, talking about the drug itself, we have to know that it is an oligosaccharide that competitively and reversibly inhibits both pancreatic alpha amylase and enzymes alpha glucosidase. So it blocks them, and by doing that, it blocks the metabolism and absorption of every carbohydrate that is ingested in the diet. So it blocks those ways, and there is nothing to digest, to metabolize, to hydrolyze the carbohydrates that are getting into our system. So there's nothing to transform that into glucose. So having that in mind, we're gonna have a patient that even after the meal, in the postprandial moments, there are not gonna be glucose peaks that could be dangerous in a patient with type 2 diabetes. So that's basically how this drug acts. And between the things that could be little but they're not about this drug, and we as med students have to know about it, we have these special considerations. So this drug, it's better if it's taken with the first bite of each meal, and in some cases it could cause hypoglycemia. In these cases, the patients have to receive an immediate dose of glucose to balance these levels. Between the adverse effects of this drug, we have just gastrointestinal manifestation, gastrointestinal symptoms such as meteorism and flatulences. And talking about the drug interactions, we have to say that this drug increases metformin's bioavailability and decreases iron's absorption. Okay, that's all I have to say today to you. I hope you liked it and I hope you learned something else. Goodbye and good morning, good evening, or good night. Thank you.